see what I'm showing on the screen
Yeah,
now?
yeah, all good.
Is it big enough that you can actually see?
It sure is. It's very big.
Okay, thank you. Okay. I wanted to talk about some things that you already know, but that get people goofed up. And so I wanted to back up, and everything I'm going to say are things that or most of what I'm going to say is in the book already, but I just wanted to emphasize some things. And I wanted to start with insulin. The whole idea that we could control insulin or estrogens or thyroid hormone or these kinds of things is a new idea for people, and insulin is a place to start because so many people are struggling with diabetes or other insulin-related diseases. So let me just walk back to the whole beginning. Every patient that we see in our medical center, and everybody who we see in a research study who has diabetes or is worried about it, thinks they got diabetes from eating sugar or carbohydrate or something like that, all of which is really not the issue. So this is a cell in your body, let's call it a muscle cell, and the cell works on a fuel called glucose, and that glucose needs to get through the cell membrane in order to power that cell. But it can't get through the membrane keeps it out. The glucose molecules just bounce right out because that cell is really selective. But there is a key, and the key is insulin, and the insulin key attaches to the surface of that cell, and it signals little channels to open up. And when that insulin key attaches to the cell and sends that signal, the glucose can come inside the cell, and the cell gets the power it wants, and everybody's feeling great. So how could this go wrong? Well, I grew up in Fargo, North Dakota, and our diet wasn't a whole lot different from the Dallas, Texas diet, meaning that was my dinner. You know what I'm talking about.
Yeah.
That's my lunch, that's my breakfast, we eat all kinds of fatty stuff. And the problem with that is that there is a fair amount of fat in these foods, and that fat ends up inside the cells. And when the fat particles, these are just microscopic particles of fat, building up inside your muscle cells. Now, doctors don't like words like fat because it's only got 3 letters. So we prefer to refer to it as intramyocellular lipid. But it's fat inside a muscle cell. And the insulin key still attaches, but it doesn't work anymore. So now the insulin key can't get through all that fat that's built up in the cell. And that's a condition called insulin resistance. And that's the beginning of that's going to lead to type 2 diabetes. And so the glucose is there. You ate a piece of bread that will break down to produce glucose, or you had something sweet like an apple, but the glucose can't get into the cell because the insulin can't work because it's filled with fat in the cell. So what do? Well, in our research studies, we said, how about if I don't eat any animal products? I'm going to do a vegan diet. Well, there's no animal fat there at all. And if I keep oils really low too, there's not much of any kind of fat. And that means the fat starts to dissipate from the cell, starts to go away. That's really cool because when you get the fat out of the cell, the insulin key can work again. And when insulin can work, it can bring the blood sugar down. It takes it out of the blood, puts it in the cell where it belongs, and now we're doing great. When this was discovered, it was a 180-degree different way of thinking about diabetes. We weren't focusing on calories. We weren't focusing on sugar. We weren't focusing on how much bread you eat. What we were focusing on is cleaning the cell out of that fat that's causing the problem. Because if I do that, I got a shot at preventing the disease in the first place and getting rid of it when people have this disease. This is a turning point. Now, let me go back and present some of the evidence that first made this come out, and this is what I'm going to tell you now is maybe new to you. Back in 1996 at Yale University, researchers brought in 9 people, and these were young, healthy folks, but they sat in a chair, and somebody put an IV in their vein, and they infused lipid or fat into their vein. And what do you think happened? Well, their insulin sensitivity started to tank. See that bottom line there? That's that lipid infusion. I copied this right out of the research paper where they reported it. That lipid infusion caused their body's ability to respond to insulin to go down, not within weeks or years. You can cause insulin resistance today, in one day. Okay?
Wow.
Now, what if I don't do it with an IV? What if I do it with a meal? Researchers brought in, at the German Diabetes Center, brought in 14 volunteers. They gave them a palm oil, a meal with quite a lot of palm oil in it, but it was not out of the range of what people would eat in the course of a day, and they found exactly the same thing. Between the left bar and the right bar, you could show their insulin sensitivity went way down. Well, now palm oil is very high in saturated fat. It's not a healthy fat. Let's take rapeseed oil, or canola oil is the other name for it. But you found the same thing there too. Here's my point. What is causing insulin not to work is fat that builds up in the cell. Animal fats, saturated fats are the worst, but even so-called sort of healthy fats can contribute to this. Why? Because you might eat a seed here or there, you might have an olive here or there, but the whole idea of taking 10,000 olives and extracting all the fat and putting it in a bottle and having you eat that, that's something nature didn't have in mind. So all of this big grease tsunami that we expose our bodies to is a cause of weight problems and a cause of type 2 diabetes. Okay, shifting gears. Oh, and by the way, if you tell other people about this, they will think you're making it up. They've never heard this because they thought they got diabetes from having Coca-Cola. But they also discovered that if they have diabetes, they will never get rid of it. They're going to have it for the rest of their life. Because nobody told them what you know now. Once you know this, and you know how to change your diet to get the fat out of your cells, you've got a good shot at improving it, reducing your medication use, maybe getting off your medicines, maybe getting rid of the disease.
Wow.
Okay, let's shift gears about estrogen. And the way I wrote about this in the book, but just to come back to it, I was sitting at my desk and a young woman called me up and said she had terrible cramps, menstrual cramps. Now, a lot of women have cramps, but for maybe 1 in 10, it's so bad that you know you're not going to work that day. Mm-hmm. And that was her situation. And she said, could I help her? And I thought, well, sure, I can give you painkillers to get you through today and tomorrow. And let's do that so you can function. But I started thinking, what can we do to prevent this from happening next month, and the month after that, and the month after that? And I started to think about something. Let me share with you my thought process. She's describing her symptoms. This, in the center of the screen, is the uterus. Off on the sides, you see the ovaries, and they're connected by the fallopian tubes. Every month, this is normal, every month, that pink lining at the center of the uterus, that's the endometrium. Every month, it thickens up in anticipation of pregnancy.
This?
And so that thick pink layer is natural, but at the end of the month, the disappointed uterus discovers that we're not pregnant, and so it sheds that layer in menstrual flow. However, what I was making an educated guess is that, let's say this young woman had a little bit too much estrogen in her blood. That would cause too much thickening of that endometrial layer. And if you thicken it up too much, what you can have is excessive flow, more clotting, and a lot of pain. And so, hold on one second. Okay, so the other possibility is something called endometriosis. And endometriosis is where you have the same endometrial cells, except now they're not inside in the uterus, they're on the outside. That's those little things that look like raisins. And they're either on the outside of the uterus, they're stuck to the ovaries, they stick to the fallopian tubes, or even in the intestinal tract. Mm-hmm. And so a woman with endometriosis has a lot of peculiar symptoms, where she gets pains, she has diarrhea that corresponds with her menstrual period, and she's having trouble making sense of it, and so is her doctor. And the problem with this, you can have surgery. You can take those little raisins out. But for about half of women, they come back and the surgery didn't really help very much. So anyway, this young woman is describing her symptoms to me, and I'm thinking it's probably one or the other of these things. And I was remembering how at Tufts University, back in 1994, researchers did something interesting. They brought in 48 women into a research study. They asked them to reduce the fat content of their diet or to increase the fiber content of their diet. Now, when I say fat, that could mean meat, animal fats, fried stuff. When I say fiber, that's a code word for beans or vegetables or fruits, plant foods, right? Okay, so they either said, let's cut the fat or let's increase the fiber, or let's do both at the same time, whatever. And what they found is really amazing. Just reducing the fat alone would reduce the amount of estrogen in a woman's blood. Now, estrogen comes in different varieties, estradiol, estrone, and others, but they went down just by cutting fat. Just by increasing fiber, the same thing happened. And this is not rocket science. Your body takes fiber out of the blood. Your liver pulls it out, and if there's a lot of your liver takes estrogen out of the blood. And if there's a lot of fiber in your intestinal tract, that estrogen sticks to the fiber and it goes out. You literally flush it down the toilet. Okay, so this young woman is telling me on the phone she's got terrible menstrual pain, and I'm thinking this is driven by too much estrogen in your blood. What if we calm down the amount of estrogen? So I suggested something I don't think any doctor ever suggested to a patient with cramps before. I said, let me give you 2 days of painkillers so you can function. But how about trying a diet as an experiment? No animal products, keep oils really low. Why would I recommend that? Because if there are no animal products in your diet, everything you eat has fiber. If you minimize oils and avoid animal products, there's not much fat. So I thought, let's see if we can do this. Now, I gotta tell you, the researchers at Tufts University weren't thinking about cramps. They were thinking about breast cancer. Because if I can reduce estrogen in a woman's blood every minute of every day, I can reduce her likelihood of developing postmenopausal breast cancer. But I wanted to apply this to cramps and see if it would help. The young woman said, I'll try anything. She did it. A month later, she called me back just thrilled because she had gotten her period that day with absolutely no symptoms. Next month, same thing. Next month, same thing. Unless she would kind of loosen the diet, then the pain would come back. So I thought, all right, we need to do a study. We brought in a group of women, and half of them did exactly that diet, and the other half got a supplement that was really just a placebo. And then after 2 cycles, two months really, they switched. So the diet group got the supplement and vice versa. And in a nutshell, it worked. What we found was that the pain intensity fell, the number of days of pain fell, and PMS symptoms like bloating and water retention and behavioral symptoms, emotional symptoms, all improved with this diet to a different degree for different women, but to a large degree, the more they did, the more they changed their diets, the better they felt. Okay, shifting gears. You may know Catherine Lawrence. And do any of you know Catherine?
Yes, uh-huh.
Okay, Catherine's not there, is she?
No, she is not today, no.
Okay, well that's too bad. Anyway, I'm gonna tell you Catherine's story, which you probably already know. But Catherine grew up in Louisiana, joined the Air Force, went to Iraq in 2003, and was working really hard. And when you're in a war zone, and you're working hard and you're eating what the government gives you, you don't gain any weight. But when her tour of duty came to an end and she went back home, her family decided to help her make up for all the things she hadn't eaten in Iraq, especially cheese. And so mac and cheese snacks and all these things kind of became front and center in her routine. And in fact, a friend sent her an entire pack of 48 boxes of mac and cheese, which she, yes, I'm not making this up, she ate them every day, 48 days straight.
Oh.
Well, she gained weight and she developed endometriosis. And she had terrible pain that got worse and worse and worse. And her doctor explained to her that this is a condition that is largely driven by genetics and so forth. And he gave her painkillers and hormonal medications and said, I'm sorry, apparently nothing's working. You got these terrible pains. Finally, the doctor said, if you want this endometriosis to really go away, and she said, I do. I need something to change. You should have a hysterectomy. Because if you just take everything out, you're not gonna have any pain anymore. But Catherine was 27, and she and her husband were still kind of newlyweds, and she was hoping to have a family. But her doctor told her that she was almost certainly infertile anyway, because the endometriosis was so extensive, it had damaged her fallopian tubes and her ovaries. She may as well just have the procedure. So she didn't have any choice, really. she decided, all right, I'll have the surgery, I'll just get everything out and I'll finally be able to function. But before she could do that, she went to see a person who had expertise in nutrition and prescribed a diet very much like what I had identified earlier and what we had proven in research. And with the guidance of a nutrition counselor, she got the animal products out of her diet and kept oils really, really low and really simplified her diet. And this was kind of a shock to her to eat this way, but she noticed something. She started feeling better. In fact, a lot better. And she was losing weight and her energy was better and her pain was diminished. But it was not gone. And as time went on, she thought, maybe I better just have the surgery because there's still some pain in there. And if I have the surgery, I can get rid of that and go on with my life. So she went to the hospital and she said she was ready to have the hysterectomy. And they put her in the operating room and they anesthetized her. And an hour later, she woke up. And her doctor was in the recovery room and he said, Catherine, I need to tell you what happened. I looked inside with a laparoscope. And when I did, I discovered that your endometriosis has all but gone away. The reason that you have pain is that you have scarring where it used to be. And that scarring caused adhesions. And so all I did was I freed up those adhesions, and I think you're going to be fine. I can't explain it, but your endometriosis just doesn't seem to be there anymore. And her mother was in the room and said, well, she went vegan, doctor. Well, the doctor said, no way. Diet doesn't cause endometriosis, and there's no way a diet change could make it go away. This has got to be a miracle. Well, miracle or not, I want to praise that doctor for not doing the hysterectomy.
Yeah.
Yes.
However, he forgot his basic physiology, which is that endometriosis is driven by estrogens and estrogens are driven by diet, and you can change that, okay? So anyway, Catherine was really the proof of that, and she lost weight, and she gained energy, and she felt terrific, and she wasn't infertile anymore. And so she then joined us at the Physicians Committee and became one of our Food for Life instructors, and it's done just a brilliant job, if I may say so, educating other people and inspiring them with the power of foods to help us take back our health. Now, I mentioned cheese, and cheese has hormones in it. That's right. Now, I don't know if you know this, but cheese comes from a cow. That's right. It comes from milk, and the milk comes from the cow, and cows don't make milk until they're pregnant. And when they give birth, that's when it starts, right? This is not rocket science. So at the risk of being a little bit creepy, I want to tell you what happens. Every glass of milk you ever had, every scoop of ice cream you ever had came from what I'm going to tell you. On every dairy in the world, somebody who's underpaid takes his left hand and puts a glove on it up to his shoulder and sticks it into the rectum of a cow, up to his elbow. And then through the rectal wall, he can feel the uterus of that cow. And he grabs it and holds it still so that with his right hand, he takes what looks like a knitting needle and jams it through her cervix and squirts in some semen that he took from a bull. Now, these animals are not volunteers, but she is not going to object to it because she is chained by the neck. And she is going to get impregnated, she's going to be impregnated that day, whether she wants it or not. And 9 months later, that's the end of her gestational period, she's giving birth. And when she does, all the farmhands gather around because there is nothing cuter than a newborn calf. And this calf is all elbows and knees and looking up at mom, and the calf is in the hay, and the mother starts kind of licking the calf and cleaning the calf, and the calf is getting to know mother. After a little while, the farmhands say, we can't let that calf nurse because that's our milk. We're going to sell that milk. So they've got a tool that they use that solves this problem. It's called a wheelbarrow. Pick the calf up by the chest, put the calf in the wheelbarrow, and you carry the calf away. Now the mother, there's no bond in nature stronger than that between a mother and her child. And that's true for every species. And she objects, she follows you, but pretty soon the gate will slam in her face and she'll stand right there and cry for her baby. And the calf will be put into an isolation hut, not that far away, and the calf will cry too. But if the calf is male, he's not going to cry for very long because people have acquired a taste for the rubbery muscle tissue of a newborn male calf. That's called veal. He's going to end up in an Italian restaurant or some other kind of restaurant where veal is the order of the day. And if she's a female calf, she's going to be raised on milk's replacer until, she's maybe a year or so old, and she's old enough to have somebody's hand up her backside. Now, in nature, a cow lives to be about 20. On a dairy farm, by about age 4, the farmer has calculated that he's not getting as much milk per unit feed as he used to. So the 4-year-old cows are rounded up, they're put on a truck. At the other end of their trajectory, their chain is put on one of their rear legs, they're hoisted up near the ceiling, their throat is slit, blood goes all over the floor, and they're turned into low-grade hamburger. Now, I know these are creepy things that I'm saying, but I'm saying it to help us understand what's going on and hopefully to motivate us to do something different. But with regard to hormones, those cows are impregnated every year until they're killed. That's usually 3 or 4 cycles. They are milked well into each pregnancy. During the pregnancy, the amount of estrogen they produce goes up, and the amount that goes into the milk is much higher. So the reason I'm telling you all of this is that glass of milk has estrogen in it. You knew it had sugar in it, lactose sugar, you know it had fat in it, but it's got estrogen in it. So every glass of milk or every slice of cheese you give to your 8-year-old son, you're feeding him estradiol. Or your 7-year-old daughter, you're feeding them sex hormones that came from a cow that happen to be an exact match for human estradiol. And that has led many researchers to believe that that is the reason why milk-drinking women have more breast cancer than other women. And this has also led people who are vegetarian for ethical reasons to say, wait a minute. The whole reason I was letting myself drink milk or eat cheese is they don't kill the cows. You kill them for meat, you don't kill them for dairy. All cows are killed on every dairy operation everywhere in the world. It's just that they are impregnated, separated from their calves, impregnated, separated from their calves about 3 or 4 times, and then they're killed. Am I cheering you up? There is no such thing as hormone-free milk. Okay, last thing. Just want to talk a little bit about menopause. This is something that we discovered just recently, and I just want to walk you through it really quickly. A lot of women have menopausal symptoms, especially hot flashes. You're 50 years old, your period's stopped, you're into menopause, and suddenly the room is 150 degrees, or this can happen at 4 in the morning and you wake up with your pajamas soaked with sweat. You go to the doctor and your doctor says, let's take HRT, hormone replacement therapy. You say, well, I looked at the side effects, I'm not sure I really want that. Our research team noticed that in Japan in the 1980s, when the diet was rice-based, there were other things too, vegetables and tofu and some meat, some fish, but really not much dairy. Hot flashes were only about 15% of women. But as the diet westernized, hot flashes became much more common, and they grew to about 40% or a little bit more by the year 2000. So what's that about? Well, part of it could be soybeans. Soy has isoflavones that are responsible for soy's anti-cancer effect, but might also have an anti-hot flash effect. However, researchers in Mexico noticed something really interesting. To the west of Cancun, on the Yucatan Peninsula, they interviewed about 118 postmenopausal Mayan women and found they didn't have hot flashes either. They were like women in Japan. They didn't have hot flashes. But what are they eating? Are they eating rice? I don't think so. They have a grain, and it's corn. Are they eating soybeans? I don't think so, but they have a bean. It's black beans. And lots of vegetables. This is la chaya. And the culture has changed in Mexico, but you could go to the Walmart now, that's that area, and they sell corn tortillas and black beans, and they sell la chaya. So our research team decided, all right, let's see if changing our diet might help hot flashes to go away. We brought in 84 women, half of them did a diet, half were in a control group with no diet change. The diet we tried was a plant-based diet, vegan diet, minimizing oils, and a half cup of whole soybeans every day. Now, the first thing we notice is that when you do this diet, you lose weight. This is kilograms, but you can see the controls didn't lose weight, but the people on the vegan diet, they lost weight really nicely. But what really mattered, they lost about 8 pounds in 12 weeks, that's great. But then what really mattered was a change in hot flashes, an 88% drop in the bothersome, the moderate to severe hot flashes. This is about what HRT will do, but all the side effects were good, you lose weight and so forth. And so not only did the vasomotor symptoms, the hot flashes, improve more in the diet group, but so did psychosocial symptoms like depression, or physical symptoms like headaches, and even sexual symptoms improved to a degree. So we now believe that this is the treatment of choice for hot flashes. Now, I mentioned soy, and when you talk about that, some people think it causes breast cancer, but the opposite is true. The soy isoflavones have been shown to reduce cancer, and in 2008, a meta-analysis of 8 prior studies showed about a 29% drop in breast cancer among the high soy consumers, and among women previously diagnosed with breast cancer. The high soy consumers had a reduction in the likelihood they would ever die of their cancer, cut the mortality by about 25 to 30%. So the reason is that these soy isoflavones have 2 places they could attach. There's an estrogen receptor alpha in your body. That's not where they go. They go to estrogen receptor beta. Alpha that's where your natural estradiol attaches. That's like the gas pedal for cancer. Estrogen receptor beta is a different receptor. That's like the brake for cancer. So let me just finish with this. If you thought, I'd like to try this. Edamame is great, but edamame is baby soybeans. Leave them on the vine till they're big like this, and you can buy them online. You'll see organic and non-GMO soybeans. Throw them in your Instant Pot, cook them for 40 minutes, or just throw them on the stove, soak them overnight, cook them just like any kind of bean. Then you take them out of your Instant Pot, and you use them like pine nuts. Or you can toast them if you want. This is fun. You cook them in your Instant Pot, put them on a baking sheet, cook them for an hour, make sure they're really thoroughly toasted. They can't be mushy, they gotta be dry. And then salt them, put on some cayenne, put on some garlic, whatever, put them in a bag, and if you're traveling, you can use them. And what you do, or frankly, if you'd rather have somebody else toast it for you, laurasoybeans.com sells you toasted, which they'll send to your house. And you can do this, there's no risk, there's no negative side effects, it's a good thing to do. But the reason we use soybeans instead of, say, just soy milk is fine. But you have to have 2 quarts of it to get the isoflavones you get in half a cup of soybeans. So there you have it. Let me stop at that point, and if there are any questions that you have, I'd be glad to tackle them.
Yeah, real quick, Dr. Barnard, there's only a few minutes left of the Zoom meeting, so if we cut off and we end, I just want to say thank you so much for giving up your personal time to do this. So thank you. Okay, I had emailed you a couple questions. Do you have those there, those emailed questions?
I do remember.
Okay.
One of them was, one or two were about thyroid hormone.
Yes.
And I want to say that I think we are really very much at the beginning of our understanding on diet and thyroid hormone. What we do know is that a very common cause of thyroid hypothyroidism is, and hyperthyroidism either way, is the production of antibodies in the blood. And we have substantial evidence that some of those antibodies, in some people at least, the trigger seems to be exposure to dairy and exposure to meat, such that when people get away from dairy and get away from meat completely, their condition improves. However, what I don't know is that just anecdotal? Is that just once in a while? Or is it fairly common? So if you have hypothyroidism or hyperthyroidism, either way, stick with your doctor. This is not a time to cancel your doctor's appointment. The first thing you want to do is get at the cause. Do you have those antibodies, or are you just low in iodine, for example? Find out the cause. If you're on medicines, stick with the medicines, but you can try the diet approach, and if you happen to improve, your doctor can titrate you down on your thyroid hormone. Now, one of the questions was a person who had the thyroid gland removed and was taking thyroid supplement for that reason. The thyroid gland is not going to grow back, and so you will continue to need the thyroid hormone. Take it on an empty stomach. Anything you eat is going to reduce the absorption of it. So there you have it.
Okay, anybody else?
I
Go
have a
ahead.
question for you, Dr. Barnard. What is your opinion about low iron? And is there a good ferritin level that's kind of normal? There's such a debate between low and high, and I happen to have a very low ferritin level, even though I've tested negative for all the normal reasons to be tested.
Okay. It's a great question. The normal levels for ferritin, there's a very wide window, and in fact you can Google this and you'll see for women it's the range is between about 11 and over 300. So what ferritin is, it's the storage form of iron. Your body says, you got a little extra iron? I'm going to store it here. I'm going to use it, keep it as ferritin, and if you need me to release it so that you can make red blood cells, I'll do that. If you are low, and I know I'm not telling you anything you don't already know, your doctor's first question is, why are you low?
Yes.
And the doctor will not, or should not, just jump into supplementing without investigating why. Because the doctor is going to think, if you're low in iron, what are you eating? If you're eating green leafy vegetables and beans, they got lots of iron in them. And we don't follow anymore the 1950s advice of have red meat and have liver, because those foods have iron, but they cause more problems than they solve. So your doctor is going to ask you these questions like, are you bleeding somewhere? And the doctor is going to say, let's have a colonoscopy and make sure that there isn't bleeding from the intestinal tract. And then once you go through all that stuff, and then the doctor is going to say, well, let's just up your iron intake. Plant-based diet, lots of greens.
Yes.
And once in a while, it's rather unusual that doesn't solve the problem. But in an unusual case, doctors might actually recommend supplemental iron. If so, you can follow your doctor's advice. A couple of caveats. One thing is, if a person is exercising like crazy, marathon runners sometimes get a little bit low in iron. The other is if a woman has a little bit too much menstrual flow, she will be losing iron, and the dietary steps that I mentioned earlier that affect estradiol function will deal with that. So that's really kind of about it. Once all those steps have been taken, then the point is what you already know. Have plant sources of iron. People will often say it's more absorbable if you add a little bit of vitamin C, like lemon juice and stuff like that. The effect is rather small. Obviously, a person should consume no dairy.
Correct.
Because milk will reduce iron absorption by 50%. But if you're doing those things and following a healthy plant-based diet, most people don't need iron supplements. If you do, it's okay to take them.
Okay. So what it hasn't really come up. It went to 12, so they put me on iron supplements, and then now it's only at 20. And so I'm just trying to understand whether that's really enough in this diet. I mean, I've been doing this for about 6 years.
Oh yeah, okay,
Whether-
very important. More is not better. The old idea, we thought, I want to be really high in iron. We now know that if you are high in iron, iron is a problem. Iron triggers the formation of free radicals, which are responsible for aging, and they contribute to heart disease. So we want to be on the low side of iron. Now, if your blood tests show that you're kind of marginal on iron, but you have no symptoms, you're fine, and your blood count is okay, more or less in the healthy range, that's fine.
Okay.
You don't want to be pushing it. If you are frankly anemic and fatigued and your blood counts are demonstrably low, then the doctor's going to want to look at all of the things that I just mentioned. But with iron, we want to be on the low side of normal.
Okay,
All right,
good.
that's good. Thank you.
Okay, Dr. Barnard, this was fantastic. Thank you again for being here with us, and we love that you continue to heal people and lead everybody in